You struggle with mental health and you want to feel better so you can start living life again. But despite trying medications and therapy, you're just not feeling as good as you once did. Well, today, I'm going to fill you in on the latest research on a diet that was shown to help adults with severe mental illness, so stick around. The journal Frontiers in Psychiatry published a study in July 2022 looking at the keto diet for refractory mental illness. This was a retrospective analysis that evaluated 31 adults with major depressive disorder, bipolar disorder, and schizoaffective disorder, whose symptoms were poorly controlled despite receiving intensive psychopharmacological management. These adults were voluntarily admitted into an inpatient psych hospital and started on the keto diet in addition to receiving usual care. So let's break down the diet real quick. Fat comprised 75 to 80% of the diet, protein 15 to 20%, and carbs 5%. The max amount of carbs someone could have in a given day was 20 grams, and so each person was given 3 meals per day in addition to a snack box. The average duration that patients participated in the keto diet was 59 days. So let's get into the good stuff and break down the results. Of the 31 patients, 3 people were unable to finish the keto diet for greater than 14 days and were excluded from the study. So that takes us down to 28 patients. 12 had a primary diagnosis of bipolar disorder, 6 had major depressive disorder, and 10 had schizoaffective disorder. What researchers found was that there were significant improvements in symptoms across all 3 diagnoses. 100% of patients had symptom improvement, and that is awesome. Not only that, 64% of patients were discharged home on either fewer medications or doses that were less than when they started. Now, another thing to address are the metabolic benefits that we're seeing from being on the keto diet. All participants in the study had at least one indicator of poor metabolic health. So they could be overweight, obese, have high blood pressure, or elevated fasting blood glucose levels. After completing the study, 96% of patients lost weight. Of those in particular who were on antipsychotic medication, 48% had a 5% or greater reduction in body weight, which is amazing. Significant changes were also seen in fasting blood glucose levels, hemoglobin A1C, systolic and diastolic blood pressure, cholesterol, triglycerides, and liver enzymes. Now, you might be wondering, how do the patients tolerate the keto diet? Anyone who has read about keto has heard of the keto flu. So yes, most patients reported at least one symptom early on when transitioning onto the diet. The most common complaints were headaches, insomnia, irritability, excitation, and carb cravings. However, all of these were mild in nature and required no medical interventions. In addition, all symptoms resolved within 2 weeks or less. So overall, it was pretty well tolerated in the vast majority of people. Now, the next thing you might be wondering is, why did those 3 patients drop out of the study then? Well, one discontinued secondary to aversions to dietary fat. One lacked family and financial support, and the other claimed they had a financial hardship, an aversion to dietary fat, and a dislike for the restrictiveness of the plan. So no, their reasons weren't because of side effects from the diet itself. Okay, so what are my thoughts about this study? In my opinion, any intervention that can be safe, effective, done at home without a medication script, and can reduce overall medication burden gets my vote of approval. Psych medications, especially antipsychotics and mood stabilizers, are notorious for having some pretty crappy side effects. So less is better in my mind. And then when you throw in the additional metabolic benefits of the diet, I'm totally on board. Now, it's important to remember that this was a relatively small study in a case series. While it added valuable information and gives us some options to consider clinically with patients, what I'd want to see moving forward are some larger randomized controlled trials that include a placebo group to further support these findings. Now, if you're looking to learn more about natural treatment options for mental health conditions, make sure to click that top video.